Good evening. My name is Vernon Mosley, and tonight I will be discussing chronic diseases and infectious diseases. I will be explaining the difference between a chronic versus an infectious disease. I will also describe a specific disease, parasitic infections, in more detail. Then I will describe the symptoms and impacts of that disease on a person and how it is treated or if there are preventative measures. Thank you to Professor Lockhart for the opportunity to present this. Let's begin. First, I would like to explain the difference between a chronic versus an infectious disease. The distinction is crucial for understanding public health and priorities. Per the CDC, the definition of a chronic disease is a condition that lasts 1 year or more and requires ongoing medical attention or limits activities of daily living. These are long-term conditions that develop slowly over time. Examples include heart disease, cancer, and diabetes. Unfortunately, these are the leading causes of death in the United States, and they are often linked to lifestyle choices, genetics, and environmental factors. According to the Cleveland Clinic, infectious diseases are illnesses caused by harmful germs that enter your body. The most common causes are viruses, bacteria, fungi, and parasites. Unlike chronic diseases, infectious diseases usually have a rapid onset and are often communicable, meaning they spread from person to person through contaminated food, water, or even bug bites. Think of the common cold, flu, or malaria. The key takeaway here is that most chronic diseases are long-lasting and often not contagious. Infectious diseases are short-term and mainly caused by transmittable pathogens. Next, I will cover a specific type of infectious disease, parasitic infections. A parasite is an organism that often lives off the body of another organism, known as the host. It can even reproduce inside the host organism, often as a detriment to the host. Parasitic infections can come in many shapes and forms, ranging from microscopic organisms like Giardia and Cryptosporidium to larger visible infections like tapeworms. Symptoms are most commonly intestinal illnesses such as diarrhea and vomiting, but they can also be present as a rash or affect parts of the body like the brain and lungs, depending on the parasite. The good news is that these diseases are typically curable. The disease is treated by prescription antibiotics or antiparasitic medications specifically designed to eliminate the organism from the body. Some behavioral choices and environmental factors that can lead to parasitic infections are unsanitary conditions, dirty water, unclean living quarters, and poor community conditions. The availability of clean drinking water and proper sanitation infrastructure is vital in preventing the spread of these parasites. Other things like unsafe food habits can also cause a parasitic infection, such as consuming undercooked meat or produce washed in contaminated water. So always make sure you're cleaning your products before you eat. Finally, bug bites, specifically mosquitoes, ticks, and fleas, are often carrion of parasitic infections. So please get any vaccinations that are required, especially when traveling to certain regions. To take preventative measures against these diseases, you must practice safe food habits, store food at the proper temperature, ensure that it is cooked thoroughly before eating, and practice proper hygiene. Proper hygiene is incredibly important to prevent the spread of parasites, particularly through regular hand washing with soap and clean water. This also helps spread parasites by canceling out any sort of bacteria or any other disease that is present when the disease is possible to spread. More information on prevention, including specific guidance for travelers for vaccinations, is available on the CDC's website for the parasitic disease section. Following these guidelines is key to staying healthy. Parasitic infections are often considered a disease of poverty and can be found globally in impoverished communities with limited access to clean water, sanitation, and healthcare. Untreated parasitics can plague an entire community and potentially lead to outbreaks in new areas. This highlights the importance of global health initiatives and access to basic necessities. Always remember to take care of yourself because health is wealth. I would like to thank Professor Lockhart for the opportunity to present this topic, and thank you for your time tonight.